Hi all my wonderful TM joiners, I'm Priya Mistry, the TMJ doc, and today I'm going to talk about disc displacement without reduction, which is basically a fancy way of saying the jaw is locked closed. This is a painful condition during which you can still open your mouth, contrary to what jaw locking closed suggests, but your range of motion is severely restricted. Has your jaw ever locked or gotten stuck closed to where you can barely open 1 or 2 finger widths? Does it happen often? Is it painful? Are you locked right now while watching this video? If so, then this is the video for you. Be sure to watch until the end to understand exactly what is happening inside the jaw joint during this painful condition. Before getting into it, be sure to check out my office website and my social media for more information on TMJ disorders. These are all wonderful resources jam-packed with information, so please be sure to check them out. For those of you who don't know me, I'm a general dentist with a practice in beautiful Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So let's get right into it. Let's start by defining some terminology. When I say the word disc, I'm referring to the articular disc, which is a pad of cartilaginous tissue inside of our jaw joints. When I say the word displacement, this means that the disc is not in its ideal position. Lastly, the term reduction is a medical term which indicates that something, a body part, is in its normal position or alignment. So in this case, reduction is not a removal or a decrease. Now let's go over some anatomy. The articular disc sits between the bony components of the joint, serving as a shock absorber or a cushion. The bony components of the joint include the condyle, which is the little bony knob that our jawbone ends on, and the temporal bone, which is a skull bone. In front of the disc sits a muscle called the lateral pterygoid muscle. And behind the disc in the joint, there is some very nervy and therefore very sensitive tissue called the retrodiscal tissue. So these are the anatomical components that are very important for us to know about before we discuss disc displacement without reduction, also known as the jaw locking closed. When we open, the condyle, the bony knob that our jawbone ends on, first rotates and then slides down the temporal bone with the articular disc remaining on top of the condyle, kind of like a hoodie. So again, when we go to open, the condyle rotates and then slides with the disc kind of sitting on top of it like a hoodie. And in normal opening, that disc does not move. It stays where it's supposed to, and there are no clicking and popping noises. For many of you, clicking and popping is a part of normal everyday life. When there is that clicking and popping, it's telling us that the little disc is coming in and out of alignment. So this animation shows that the disc, which is in blue, is not in proper alignment. It is not sitting on top of the condyle like a hoodie. Instead, it's too far forward. It's out of alignment. An important thing to stop and note here is that when the teeth are together and the mouth is closed, that is actually when the disc is out of alignment. So that's actually when there's a problem inside the joint. Then we go to open and pop the condyle, and the disc can get back into proper alignment for a short while until we close again. Click. I love this animation because it shows that so clearly. So again, with clicking and popping, when the teeth are together, that's when the disc is out of alignment. That's when there's a problem in the joint. However, because the jaw joint is clicking and popping, we know the disc can get back in alignment for a short while. That clicking and popping sound is literally the disc coming in and out of alignment. When clicking and popping is present, that dysfunction inside the jaw joint is called disc displacement with reduction. The disc is displaced too far forward and in, but it can reduce. It can get back in proper alignment for a short while on opening with that pop. And again, the term reduction in medical terminology is referring to a body part that can get back to its normal position or normal alignment. Disc displacement without reduction occurs when the disc is displaced and it cannot get back in its proper alignment. It cannot reduce. Instead, the disc stays too far forward and actually starts serving as a barrier to opening. This will truly limit how much we can open our mouths. This animation shows that the disc is out of alignment. It's too far forward and in, actually, too. And when the animated jaw goes to open, the condyle and the disc do not get back in proper alignment. The disc does not reduce. That is why this condition is called disc displacement without reduction. Many individuals who experience disc displacement without reduction have had a history of clicking and popping noises within the joint. For some, this clicking and popping has gone on for several years, and for others, that clicking and popping has been a pretty recent onset. To be clear, that history of clicking and popping tells us that there's already a problem inside of the jaw joints. The disc is coming in and out of alignment, which is not ideal. Now, it can stay this way forever, or it can progress to disc displacement without reduction, or the jaw locking closed. It's impossible to say for any given individual at any given time whether it will progress to this more serious condition or whether it will stay clicking and popping forever. In addition to having a history of clicking and popping, individuals who experience disc displacement without reduction will also have a moderate to severe amount of pain that comes along with this condition. They may also feel that their bite just feels kind of off. They will likely have deflection or deviation on opening. That means their mouth will move to one side or the other after this condition occurs. And lastly, of course, they'll have a very limited range of motion. So let's discuss all of these one by one, starting with the moderate to severe amount of pain that many individuals experience with this condition. When the disc is displaced without reduction, the muscles of the head, neck, and jaw go into spasm, and they enter a very dysfunctional state, particularly the lateral pterygoid muscle. The lateral pterygoid muscle is a muscle that actually, the superior head of it, attaches to the disc within the joint. So the job of this muscle is sort of to guard and protect that disc. And when that disc is not in alignment, that muscle goes into spasm and it can wreak havoc. It can cause a lot of pain. It can cause headaches, jaw pain, ear pain, pain behind the eye, specific tooth pain, and more. Patients with this condition usually report a 7, 8, or 9 out of 10 pain level on the pain scale. So this is not an easy thing to go through by any means. Additionally, when the disc is stuck too far forward, as it is in this condition, it pulls the tissue that's attached behind it too far forward. And what is that tissue? That's the nervy, sensitive retrodiscal tissue that we talked about at the beginning. So now that tissue is displaced, it's too far forward, and it's compressed between the bony components of the joints. And this hurts, particularly when these patients clench or when they go to chew any food really, but especially tougher foods. As a quick side note, we definitely discourage chewing tougher foods if you are experiencing this condition. You want to baby the joints, you want to baby the muscles, so softer foods are definitely recommended if you are experiencing disc displacement without reduction. Now let's move on to why the bite feels off. When the disc is displaced without reduction, the jaw is actually, this whole jawbone is actually in a slightly different position because the alignment in the joint is off. Now this whole jawbone also houses all of our lower teeth. So if it's in a slightly different position, then the lower teeth are going to hit the upper teeth a little bit differently. And this is perceived as or feels like the bite is off. Lastly, with disc displacement without reduction, there's also deflection to one side on opening. So this is much easier to demonstrate with my hands. So look up if you're listening and take a look at what I'm doing. So essentially, if my left side is locked, if the disc in this joint right here is too far forward and in, then the condyle, so my fists are serving as the condyles here, the condyle can actually still rotate, and then when it goes to slide so we can open fully, this side gets stuck because the disc is in the way, but this side can keep going. So as an individual with this condition opens, their whole jaw is going to deflect to the side that has the dysfunction. So that's sort of one thing to watch for, so you can kind of self-diagnose, or if any dentists are watching this, that's really one good thing to look for in your patients if they're totally just deflecting off to one side. To find out how I treat disc displacement without reduction in my office with a 90% success rate, please watch my video, How I Treat the Locked Jaw, Jaw Locked Closed, which I've linked above and below. So that's really it, my friends. Again, I'm Dr. Mistry, and I hope you found this video helpful. If so, please like, subscribe, and share with your family and friends. Questions and comments are welcome as always, so let me know. Do you experience clicking and popping? Has your jaw ever locked closed? Does it lock consistently? Is this just a part of your normal life? Please feel free to sound off below. And remember, my friends, you can never have TMI about TMJ. Thank you.